Welcome, Dr. Ghiyas, to our podcast. Thank you for being here and for agreeing to share some of your insights from working in the NHS.
Thank you. Thanks for having me here. The pleasure is mine.
Dr. Ghiyas did his MBBS overseas in India, and after completing his MBBS, he worked in clinical medicine in industrial health and primary care settings, and he completed his post graduation in internal medicine. After completing that, Dr. Ghiyas worked in urban areas as well as rural health settings, including in emergency contexts as well as intensive care, and has done a lot of service in the rural parts of India during COVID, and is now currently a clinical fellow in a university acute NHS trust in the south of England. So we'll start with a few questions that are sort of aimed at helping some people who wants to move and work in the NHS. So before we begin and sort of do a deep dive into the questions, Dr. Ghayas, would you be willing to share with the audience how do you feel about working in the UK, especially moving over from India and working in a UK context?
Yeah, when I first moved here, it was a bit of overwhelming because the system was drastically different from what it was in India, and there were a lot of things to learn, a lot of things to get used to, because everything here is digitalized, and there are a lot of evidence-based medicine and guideline-based medicine being practiced here. So it's more polished here in a way. We can say that, even though we see more number of patients back home in India, and the clinical experience back home is great, but they're more guideline based approach and sticking to the guidelines when it comes to UK medical practice. So in that way, we get used to it, and it takes for about 3 to 4 months to get used to that. And also, some things which I find really good here are that people don't get exposed to unnecessary medicines, unnecessary, especially unnecessary antibiotics, and we follow very strictly if there are any isolation guidelines. And yeah, that's the one thing. It doesn't matter whether you're rich or you're poor. It doesn't matter what strata you belong to. If you need a isolation room, you get it. So back home, it used to be like that. That if you can spend some money, you get in a room. And if you are immunocompromised, it doesn't matter. You still have to stay in the ward. So here, if a person is immunocompromised and he's prone to get infections, then they get a separate room. So these are definitely some good things about NHS.
I can certainly agree with the following guidelines. And this is an example that I saw recently where there was a person that had stroke, and that person, I asked one of my friends to just check in on that particular patient back in India, and the treatment that that person was being given, it's exactly the same in that hospital that was given about 10 or 12 years ago when I was an intern.
Okay.
And it's exactly the treatment that had absolutely no clinical correlation. So it's not part of the usual guidelines. And it's exactly the same. And what you're talking about, egalitarianism, again, I've not worked in the NHS myself, but I can certainly see how equality and the right to get healthcare is certainly something that you see in these forms of socialized medicine. So thank you for that. And in terms of people trying to work in the NHS and going through their PLAB journey and all of that, there has been a sort of constrained labor market where people are finding it slightly more challenging to get jobs
Yeah.
than it was maybe a couple of years ago. Can you maybe throw a light? How difficult has it been for people these days to get a job in the NHS?
Yeah, previously if you see pre-COVID era and if you compare that to now, it has definitely become more difficult. I think one of the reasons for that is because entering into training here in UK, in other countries uh, they prefer their own nationals, and in UK there is no differentiation irrespective of whether you have got ILR or if you are a national here. So that is other thing that all of the anyone who practices in NHS has equal opportunity to enter into training. So that is the reason there is more demand. The people want to come to UK, and the huge number of doctors who are applying. That is number one thing. Apart from that, definitely the recent introduction of physician associates and other allied health professionals into hospital settings and GP practices, that is probably contributing to difficulty in getting the jobs. Also, there are some other factors like people, they're not very well versed with the application process and the refining of CVs here.
I think great point. And we can't comment on the topic of physician associates. I think people can argue on both sides. And we've had some passionate discussions in the past about the pros and cons of that. But what we can certainly help people with is the process, because I think even though a lot of the people are finding it difficult, there is still a lot of opportunity in getting into the system and having a career that everyone dreams of in the
There is
NHS.
definitely, yeah, I would agree that. Yeah, I would agree on that point because a lot of
Yeah.
British nationals, they are now moving to other countries like Australia. So there is still a lot of opportunity for people coming from developing countries to UK, but they have to know how to apply and how to enter into the system.
Yeah, absolutely. And people can talk about the pros and cons of the NHS, how NHS is versus how Australia is, how that country is. But I think applicants can benefit from thinking is how much of an improvement working in the NHS would be as compared to their own native systems of healthcare.
Exactly. Yeah. So if especially people who are in early days of their post graduation, I mean, right after they have completed their primary medical qualification MBBS in their home countries, the one more thing people migrate to the UK is the difference of pay here. Because in back home, they work for like more than 70 to 80 hours per week and they are paid almost peanuts. And when they come to UK, even though people say that the pay is not as good as it was the 10 to 15 years back, but if a person who is single right after the completion of MBBS, or even if he has a small family, especially after the recent strikes and marginal increase in the pay, it's still a lot better than if the home countries, I mean, or the developing countries.
Yeah, I fully agree with you on that. So, in terms of some kind of tips, let's say in this competitive environment where more people try to come in and the job market has slightly changed since the last couple of years, how would you say that people can still find jobs in the NHS after completing their PLAB, for instance?
Yeah, I've seen people who apply using the same methods as they would apply in their home countries, and I have helped a lot of people to see to check their CVs, to help them getting interviews, and to do some mock interviews as well. And I can see definitely some scope of improvement, whether it's interview preparation or whether making the CVs as a UK that would be good at UK standards. So there are a lot of things, and what to do before you come to the UK. When you're home country, what are the things you should do so that you are more employable in UK? If you look at it as from the employer's point of view, from the hospital trust point of view, so we need to see what are the routine cases they get here because of the population, because of the demographics, because there are a lot of elderly population here, and there's a lot of scope of geriatrics and the special health issues related to the elderly population. So if you know what the UK wants, if you know what the UK population demands, you can make yourself better prepared in that context.
Great point. And this is certainly the case, not just for just trying to apply to the UK, but people moving from one country to the other. And finding a way to talk to the audience in that new country is critical to be able to get either jobs or perform well in interviews. It would be exactly the same in the NHS. Yes, your knowledge and context slightly changes if it's medical versus non-medical or non-healthcare, but the fundamental principles still apply.
Yeah, yeah.
So, are there any alternate paths that people can do or undertake before coming, which increases their chances
Yeah.
of, let's say, getting an appropriate job in the NHS?
Definitely, one of the most common method that people use to come to UK is the plab route. That is right after the MBBS, they complete the PLAB exams, that is licensing exam, and then try to apply for jobs. But especially in these conditions where there is a huge competition at junior level, people can definitely go for membership exams and apply at middle grade or registrar post. So in medicine, in emergency, there's lot of opportunity to get jobs. If you complete your membership exams like MRCP or MRCEM, and then applying for jobs is, I think it's definitely a better way if you're spending some time in your country. By this way, you can bypass spending some years as a junior doctor here, and straight away get into middle grade, and your chances of getting into higher specialty training would also be more in that case.
So, are you saying that by giving some exams, people would increase the chances of not only getting jobs, but then it would speed up the process of their career progression
Exactly. Yeah.
in the
Yeah.
NHS and the UK health system?
Yeah, that's exactly what I'm saying.
Okay. And in terms of, wouldn't that make them slightly overqualified for the roles that they're applying then for?
Overqualification, I think, is more relevant with surgical specialties, and it's not particularly important for medical specialties. For medical specialties, it's more it's better if you are if you have completed your specialty examinations, if you have some post graduation in your home country, or if you have some good clinical experience. So it doesn't matter if you're overqualified in medical specialties, and even if you don't, so in some cases, people who have these exams and who have enough clinical experience, they can come straight away as specialist or as a consultants even. So I don't think overqualification is an issue with medical specialties.
Okay. And we've got plans to have these interview style podcasts into the future. And Dr. Ghayas will be coming again and we'll be inviting other guests as well, where you can have your questions answered. Please feel free to drop your comments below so that we can cover that in the subsequent podcasts. And do hit the subscribe and the bell icon so that you know when the next video is released. Thank you for watching. And until next time, peace.
Thank you.